You may have wondered if psychotherapy is effective. The answer can be a bit complicated. If we only measured effectiveness using client testimonials, then the answer would almost certainly be yes. Almost 90% were fairly well satisfied. However, critics believe that there are a few reasons to be skeptical. First off, most people enter therapy in crisis. When the crisis passes, people may attribute their improvements to therapy. In Chapter 1, we learned about the placebo effect, which leads to the next point. Clients believe that the treatment will be effective. This positive expectation may lead to positive outcomes. Clients also speak kindly of their therapist. Even if the problems that the client are facing are still there, they will often work hard to find something positive to say about their therapist. Lastly, clients want to believe that therapy was worth the effort. This is called effort justification. When people invest time and money into something, they're motivated to find something positive about it. From the clinician's perspective, we would also suspect that psychotherapy is effective. However, therapists, like the rest of us, are vulnerable to cognitive errors. Confirmation bias can lead them to unconsciously seek evidence that confirms their beliefs and ignores contradictory evidence. They may be more likely to remember the clients who later expressed gratitude for their treatment, and forget about those who left with only temporary relief. Luckily, we also use more formal assessments to determine if psychotherapy is effective. Meta-analysis, a statistical procedure that combines the conclusions of a large number of different studies, has shown that the average therapy client ends up better off than 80% of the untreated individuals. Those not undergoing therapy often improve, but those undergoing therapy are more likely to improve, and to improve more quickly and with less risk of relapse. There isn't a specific type of psychotherapy that's superior to others. However, the more specific someone's problem is, the greater the hope psychotherapy might solve it. Some forms of therapy are more effective at treating particular problems. Cognitive and cognitive behavioral therapies help treat anxiety, PTSD, insomnia, and depression. Behavioral conditioning therapies help treat behavioral problems, such as bedwetting, phobias, compulsions, marital problems, and sexual dysfunctions. Psychodynamic therapy helps treat depression and anxiety. Person-centered counseling helps treat mild to moderate depression. All psychotherapies appear to share three basic benefits. The first is offering hope for demoralized people. People seeking therapy typically feel anxious, depressed, self-disapproving, and incapable of turning things around. What any psychotherapy offers are the expectation that things can and will get better with commitment from the therapy seeker. This belief, apart from any therapeutic technique, may improve morale, creates feelings of self-efficacy, and diminish symptoms. It also offers a new perspective. Every therapy offers people a plausible explanation of their symptoms. Armed with a believable, fresh perspective, they may approach life with a new attitude, open to making changes in their behaviors and their view of themselves. Lastly, psychotherapy offers an empathic, trusting, and caring relationship. Therapists want to understand the client's experience. They communicate care and concern and earn trust through listening, reassurance, and guidance. They help clients evaluate themselves, link one aspect of their life with another, and gain insight into their interactions with others. The emotional bond between therapists and clients, called the therapeutic alliance, helps explain why empathic, caring therapists are especially effective. A strong therapeutic alliance predicted less frequent suicidal thoughts, self-harming behaviors, and suicide attempts. Our lives are filled with ups and downs. It may be helpful to visit a mental health professional if you experience any of the following: feelings of hopelessness, deep and lasting depression, self-destructive behavior, disruptive fears, sudden mood shifts, thoughts of suicide, compulsive rituals, sexual difficulties, or hearing voices or seeing things that others don't experience. When you meet with a therapist, you might want to have a preliminary consultation with 2 or 3. Meeting with more than one therapist gives you more opportunities to find someone whom you feel comfortable sharing with. Since you're an ISU student, you have access to the Counseling and Testing Center on campus. The cost of this service is covered by your student fees, so please utilize it. I'll post the link to their website on our course page. There are a few different professionals who provide psychotherapy. Clinical psychologists have either a PhD, which means their training not only involved learning about therapy, but also how to conduct research, or a PsyD, which focuses solely on training in therapy. They can see patients with mild to severe mental health concerns. Their focus is providing therapy and tools to their clients. Psychiatrists are physicians who specialize in the treatment of psychological disorders. They treat patients who have the most severe problems. They also can prescribe medications to treat those problems, although certain states also allow psychologists to do this after they complete additional training. Clinical or psychiatric social workers mostly treat clients who need help with everyday problems and family problems. Counselors specialize in areas such as substance abuse or marriage and family therapy. Regardless of which type of mental health professional a person visits, they have a code of ethics that they have to abide by. These principles include that they seek to benefit you and that they do you no harm. They establish a feeling of trust and defined role as your therapist. They are honest, truthful, and accurate. They are fair and promote justice for you and others. They respect the dignity and worth of you and others. And they recognize the right to privacy, confidentiality, and self-determination.